with the screws, which means screws and rods. We put everything in the spine is stabilized. This is the fragment of disc that had come out of the disc space and was sitting on the nerve sac. You can see there are several large fragments. Even some of these fragments are even parts of the outer shell of the disc, the harder part of the disc we call the annulus. So not just the nucleus, the jelly part, but also the outer rim of the disc. Here's the more gelatinous part of the central disc. We can see it's pretty big. If you measure it, it measures a span of about 4.5 centimeters, so almost 2 inches of disc material that was in the canal smashing the nerve. And if you look at the picture right next to us, you can see the image on the left shows the spine nicely aligned and those 6 screws in place. The screws are symmetrical, so it looks like there's only 1 screw in each bone, but there's actually 2. You go to the right, you can see the other image of the spine straight on. You can see the 6 screws connected by 2 rods. There's 2 penguin-shaped plates. Those are actually plates holding those grafts in the front, and then the bone graft in the front of the spine. So what you can't see there is the bone graft on the side of the spine that will allow it to heal on the back side, and then also where the area where we open the space to decompress the nerves. But everything's looking good. We saw an improvement in the neurologic monitoring in the legs, which is a good sign for an early prognosis that the legs will feel better when she wakes up, and over time the spine will fuse and hopefully we'll have an asymptomatic, pain-free patient. Thank you.